Hello, I'm Charlotte Marie for Health Partners Cancer Care. I'm here to help guide you through your chemotherapy journey. We're here to provide the information and support you need to head into your treatments with the confidence and reassurance that you're not in this alone. We know things are overwhelming and the road ahead might make you a bit nervous, but chemotherapy has come a long way in the last few years, so it's most likely very different from the chemo experiences you might have heard about in the past. Today, people undergoing chemotherapy are often able to continue living their lives as usual thanks to these advancements. There are also more ways of managing and minimizing the side effects than ever before. Ultimately, the type of cancer and chemo drugs being used will determine what types of effects you'll feel from the treatment, and it's different for every person. Let's take a look at what's ahead and how we'll work together to make sure your experience is as smooth as possible. We'll look at why chemotherapy is an important part of your cancer treatment, what side effects to expect and how to manage them, and ways you can prepare for your treatment because learning about the process can help you feel more at ease about it. First, let's talk about what chemotherapy is and how it works. Chemotherapy is the use of drugs to destroy cancer cells, control cancer growth, or alleviate symptoms. It can be administered in a variety of ways, such as intravenously, orally, or through an injection. The type of cancer you have determines the form of chemo you will receive. Chemotherapy can target cancer anywhere in your body by moving through your bloodstream. Some normal cells will be affected by chemo in addition to cancer cells. This damage to normal cells creates many of the common side effects of treatment. Let's review the side effects you might experience as you begin therapy. These can include nausea and vomiting, changes in your appetite or taste, temporary hair loss or thinning, temporary changes to the color of your urine, mouth sores, neuropathy, changes to skin and nails, diarrhea and constipation, anemia, and fatigue. Now, you won't necessarily get all of these side effects, but since early intervention can help reduce their severity, it's important to keep track of them and let your care team know if they do show up. Many side effects like nausea and vomiting can be remedied with medications, while others respond well to small changes in your routine and eating habits. You and your care team will work together to develop a plan for managing all of your symptoms, including consulting with specialists like a dietitian. Another side effect we want to talk about is bone marrow suppression. Bone marrow suppression is when fewer blood cells are made in the marrow due to the effect of chemotherapy. While this puts you at a higher risk of developing an infection, there are practical measures you and your support network can take to lower the risk and stay safe. They include washing your hands frequently and asking anyone coming into your home or in contact with you to do the same, avoiding people with cold or flu symptoms, staying hydrated, and balancing activity with rest. And although it's not a side effect, if you develop a fever, please call your care team immediately. Now let's talk about your first chemo treatment, including what you should bring to an infusion, how long it will take, and managing the physical changes and feelings you might have. If you're receiving infusions, the process can last several hours, so you'll want to be prepared to make a day of it. There may be an hour or two before you begin your infusions where the treatment is being prepared, blood work is being analyzed, and pre-treatment drugs such as anti-nausea medications are given time to take effect. The treatment duration can vary quite a bit too, depending on your individual plan. You could come every day, every week, or once a month. You'll receive additional written resources to learn more about your care, including frequency and the way it's administered. Some people find it helpful to do a tour before heading into their first appointment so they know exactly what to anticipate. Talk to your care team about visiting a cancer center where you'll receive your infusion so you can get comfortable with the setting, environment, and equipment. Each patient's treatment is different, and so is the length of their infusion. Some might last multiple hours. Since it can take a full day, many people pack a chemo bag full of things to help them stay comfortable, relaxed, and keep their mind occupied. We have blankets, pillows, and limited snacks on hand, but feel free to bring your own too. It's also a good idea to pack a lunch for longer days. Some additional things you might want to bring include extra layers of clothes you can put on or take off depending on the temperature, crafting or drawing supplies, books, a laptop, phone charger, headphones, and any other comforting items that you'd want to have along with you. Wi-Fi is available, and some people like to escape into a podcast, book, show, or movie to take their mind off what's happening in the moment. Others enjoy talking on the phone with a loved one. You can also check with your care team about the policy for having a caregiver with you during your treatment session. Whatever your preference is, it's helpful to come prepared. Having somebody drive you home from your infusion appointment is a good idea, since the treatment and some of the drugs can make you feel tired. Take notes each time about how you feel and what you wish you had with you so you can adjust for the next appointments. You'll eventually get in tune with how your mind and body respond to the treatments, and it will become a familiar routine. It's completely normal to begin feeling emotional shifts and changes in your intimate and personal relationships. Your relationship with your sexuality, sense of self, and body image can become complicated during chemotherapy. But you should know that you don't have to go through it alone. It can be tough to talk about these issues, but having a solid community and support system is essential. We're here when you need to reach out. Help and support is readily available on-site within the cancer program, as well as additional after-hours support and outside community resources. Some of the support networks available include mental health counseling, sexual health consultants and therapists, palliative care, nutritionists, social workers, and support groups. It's important to us that you have all the tools you need to manage the stress and side effects of chemotherapy. Please don't hesitate to ask questions or let us know what we can do to help you.